Prior to giving sub-Q fluids to your cat, it's helpful to warm the fluid by submersing the bag in a warm water bath to bring the fluids up to temperature, which will be more comfortable for your cat. You always want to make sure you're using a fresh needle each time you administer your fluids. To change your needle off the line, you will simply twist the locking mechanism to free up the needle, turn your needle to loosen and pull straight off. Your fresh needle will have a sterile seal. Twist to break that seal and place your needle on the end of your line. Place it snugly but not too tight so it's easy to remove once you're done. Slide your locking mechanism back in place and twist to secure. Your vet will prescribe a certain amount of fluids to give to your cat, and you will have that shown in numerical markings on the side of your bag. The first 100 milliliters of a freshly opened bag will be from the top to the number 1. The final 100 milliliters will be from the number 9 to the bottom of your bag. And you may have 50 milliliter markings indicated by the smaller line in between each number. We have a line running from the bottom of the bag. The line has already been what we call bled, meaning there is fluid from the bag all the way through the line, so there's no air in our line anymore. There is a white clip with a simple rolling mechanism, which you engage towards the top of the clip to open the line. Right now the line is clamped off. There's also a green clamp that you can pinch to close the line if you feel like you need a little extra security. To open it, you simply move the clamp back into the open portion so the line can run through it. All right, our injection site, the most sub-Q space that Miss Penelope will have is going to be right between her shoulder blades. I always like to give the cat some pets and let her know where I'm going to be working so she's not startled before we give the injection. Simply lift the skin right between her shoulder blades into a triangle tenting position using your 3 forefingers, and using your pointer finger, you'll be able to feel the pocket where your needle is going to be injected into. Simply remove the cat by pulling straight off of the needle. Hi, sweetheart. And then we prepare for our injection. The fluid will flow better if the bevel of the needle is pointed up as you inject. The tricky part about injecting is being confident enough to go in one smooth motion. The slower you go, actually, the more difficult it will be for the cat. If you're able to go in one steady, smooth motion through the skin, they feel it less. So again, we pinch the skin, we have our pocket, and one quick pull. I know. Yes, she says, I still felt it, guys. Sometimes it's good to have a helper to hold the kitty steady as you're doing this. So once your needle is under the skin, simply roll your clamp mechanism up so that it is completely open. And you'll be able to see the hub at the bottom of the bag where the fluid is flowing. You want a nice rapid drip, and it helps flow faster if the bag is lifted up high. And then we simply watch our markings. Penelope's going to get 50 milliliters, which, since we already bled some of her bag, is going to be to the 1 for her today. Very good. It's also helpful to have a nice comfortable spot for the cat to sit while you're giving the fluids, such as a towel or a basket or a favorite bed. And I like to, if you're doing this at home and they have a favorite treat, you can give them a treat before and after they get the fluids, which helps make it be a more rewarding experience. All right. Some problems that you might run into. Sometimes the needle can actually go through the skin and come out the other side. So if you happen to notice a little bit of liquid leaking out, simply draw back on your needle and redirect. If you have to stop the fluids, turn off your line and pull the needle all the way out, put on a fresh needle and try again, that's okay too. If your line is not flowing as quickly as you'd like, you can either raise the bag, or if you have a helper, they can roll the top of the bag down to squeeze the fluid out faster. Very good girl. Once you have given the appropriate amount of fluid, simply roll the clamp back down to turn off, to clamp down the line so you stop the flow of your fluids. You'll see there's nothing flowing from the bag. When you draw the needle out, draw out in a straight, smooth motion, and it's helpful to just gently hold the area where you drew the needle out closed, as there might be some fluid leaking out. Occasionally that fluid might have a pink tinge to it, which is normal. It just means that there was a little superficial capillary hit when you drew the needle out, and that's okay. Sometimes a little tissue or paper towel is needed to stop any fluid leaking. And that's it.